If you're a federal employee or retiree trying to figure out how your federal employee health benefits and Medicare work together, there are some critical things you need to know that could save or cost you thousands, and I'm going to clear up the confusion once and for all. And by the way, shout out to this commenter over here who asked me about this exact topic in the comments. It was a great question and inspired today's video. So you've got FEHB through your federal job, and now you're hearing about Medicare, and nobody's really explaining how they work together in a way that you can understand. So let's break it down. FEHB is your insurance program as a federal employee. Medicare is the federal health insurance program for people 65 and older, or if you have certain disabilities. The key thing most people miss is that these programs work differently depending on whether you're still working or you're retired. So if you're still an active federal employee, your FEHB plan is your primary coverage, so it pays first. If you have Medicare due to a disability, Medicare is secondary. This is important because it determines who picks up the tab first when you go to the doctor or hospital. And you can delay signing up for Medicare Part B without penalty as long as you're still working and covered by FEHB. But once you retire, you'll have a special enrollment period to sign up. If you're retired, this is where it changes. Medicare Parts A and B become your primary coverage, paying first. Your FEHB plan is now secondary, picking up things like deductibles, copays, and coinsurance that Medicare doesn't cover. This coordination can often lower your out-of-pocket costs, and some FEHB plans even waive cost sharing completely when Medicare is primary. Now let's talk about what's happening in 2026, because Medicare's Part B premiums are projected to jump to $206.50 per month. That's an 11.6% increase. The Part B deductible is also going up to $288. Meanwhile, we just saw FEHB premiums increase 13.5% for 2025, with more increases expected in 2026. Here's the thing, your FEHB premiums stay the same whether you take Medicare or not. They don't go up or down based on your enrollment choice. Now, here are your main options when it comes to Medicare and FEHB. Option 1 is Part A only, which is for most people still work. If you're an active federal employee past 65, FEHB still is your primary coverage. Since Medicare Part A is usually premium free, most people enroll in it at 65. It gives you extra hospital protection without costing you anything extra. And you can safely delay Part B while working and pick it up later when you retire, penalty free. And you're usually entitled to premium free Part A because you or your spouse paid Medicare taxes for at least 40 quarters or 10 years. Option 2 is Parts A plus B, which is for most retirees. If you're retired or an annuitant, Medicare becomes your primary coverage, and enrolling in both Parts A and B makes sense here because then FEHB is secondary and picks up what Medicare doesn't. This coordination of benefits usually saves retirees money in the long run, even with the Part B premium. Option 3 is to skip Part B, and this is usually chosen if you're still active. If you're still working and you have FEHB and want to avoid the Part B premium, you can skip it while keeping your FEHB as primary. Later on, though, when you retire, you'll have a special enrollment period to sign up for Part B without penalty. This option only really makes sense while you're still an active employee, since FEHB already covers you fully, and your FEHB plan already provides what's called credible prescription drug coverage. This means when you retire, you can get a Part D plan and won't face a late enrollment penalty, but only if you sign up within 63 days of retiring. Now, if you have a health savings account or HSA, you're no longer eligible to contribute to an HSA once you have Medicare. This catches a lot of people off guard, so just keep that in mind. One big plus with Medicare is provider access. About 95% of doctors nationwide accept Medicare, which can give you a lot more options than your FEHB network alone. And some FEHB carriers offer their own Medicare Advantage plans, so if you're enrolled in Parts A and B, these plans often include extras like dental, vision, or hearing. For postal workers, you're now under PSHB, not FEHB, and there is a big difference between the two. With FEHB, Medicare Part B is optional, but with PSHB, if you become eligible for Medicare, you are required to enroll in Part B in order to keep your PSHB coverage. There are some limited exceptions, but for most retirees, Part B is mandatory. So here's what I recommend y'all do. Add up your current out-of-pocket costs with FEHB alone. Compare that to paying FEHB premiums plus the Medicare Part B premium minus the cost you'd save from coordination. Check if your doctors accept Medicare. This expands your flexibility. And then think long-term. Health needs usually grow with age, so having both can give you peace of mind and protection. With Medicare and FEHB premiums both going up, knowing how to coordinate your coverage is more important than ever. The right setup can truly maximize your benefits and minimize your costs. Look, every situation is different, and that's exactly why I'm here. I'm Callie Navarrete, a licensed insurance broker and certified Medicare expert. I help people navigate Medicare every single day, and I'm here to do the same for you. If you have any questions about how your FEHB and Medicare coordination work together, call me or schedule an appointment. I'd be happy to help you. And drop your questions down in the comments below. I read and respond to every single one, and they might even turn into a future video just like this one. And if this video helped you understand how federal employee health benefits and Medicare work together, please hit that like button and subscribe to the channel. And after that, click right here to check out my next video with more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.